My guest today is someone whose name and website I must say so many times in each of my doula training sessions and in all my childbirth class. And you're going to know why, because it's so hard today to sort through all the information, fear and misinformation about birth, and to know who to trust. Who's providing you with the good look at what the studies show is safest, as well as the risks and the alternatives to ensure that you're making an informed decision about your body, your baby, and your birth. My guest today is here to talk to you about taking back control of your pregnancy with evidence-based approaches. Hi, I'm Debra Pascali-Bonaro, founder and director of OrgasmicBirth and host of the OrgasmicBirth podcast. Did you guess why I'm so excited today? Well, joining me today, I am so honored, is Rebecca Decker, a nurse with her PhD. She's founder and CEO of Evidence-Based Birth and author of Babies Are Not Pizzas, They're Born, Not Delivered. Previously, Dr. Decker was an assistant professor of nursing at the University of Kentucky. In 2016, she shifted gears to focus full-time on the mission of evidence-based birth. Dr. Decker and Team EBB are committed to creating a world in which all families have access to safe, respectful, evidence-based, and empowering care during pregnancy, birth, and postpartum. Evidence-based birth does this boldly, making the research evidence on childbirth freely and publicly accessible. Dr. Decker is also host of the Evidence-Based Birth podcast with more than 5.5 million downloads. Oh my goodness. Well, it is such an honor to have you join me today, Rebecca, because I truly say your name and mention your website so many times. Thank you for joining us.
Thank you, Deborah, so much for having me. I'm so excited to be here to talk with you and your listeners.
What you have done is just so important for all of us as doulas, as birthing people. Your website is really one of the core sites where I think people can get the evidence that they need. But I know whenever we do something, it often starts from a personal journey. And I'm wondering if you could share a little bit about your own journey with birth.
Sure, yeah. So I guess all of us have an origin story when it comes to birth, and I'm sure we could trace it back even further. But for me, my personal experience with birth happened at the birth of my first child. When I was a doctoral student, I gave birth at the hospital affiliated with my university. And because I was already a registered nurse, I was working on my doctorate in nursing. I had experience as a staff nurse, not in labor and delivery, but I knew how hospitals worked. And one of the ways that I knew that they worked is that if you push back or rock the boat, you might get treated worse, actually, especially where I was giving birth. So I really wanted the nurses and the doctors to like me. I didn't want to push too hard back on anything they recommended. So when I went into labor, and I was told you're not allowed to get out of bed, you're not allowed to eat, you have to be hooked up to this, you have to be hooked up to that. The only thing I declined was Pitocin because I was already having contractions, so I didn't think it was necessary. But otherwise, I just followed all the rules. And I thought some of them were strange, like the fact that they wouldn't let me go to the bathroom. I had to use a bedpan because they were afraid if I stood up that the cord would prolapse because my waters had broken. And at the time, I didn't know enough. Like, I knew enough about birth that I knew what was going on, but I didn't know why these things were being suggested. And I assumed there was a good reason for them because this is an academic medical center. And at least in the College of Nursing side, we were always talking about evidence-based practice. So I was kind of just trusting everyone. And I have always been a little bit too naive and trusting. I come from a family where honesty is like one of our core values. So it never really occurred to me that these things might just be done because that's what they wanted to do, not because there was any evidence backing it up. And so afterwards, about a year later, I started researching what happened to me. I made a bullet point list of everything that was done to me during labor and started looking up the research and found that most of what had happened to me was either not helpful or had been shown by research to be harmful, such as laying on my back for 24 hours. I ended up needing a vacuum assisted delivery. I pushed for more than 3 hours with a small baby. She was only 6.5 pounds. And I then went on to make very different decisions with my second and third babies. And after my second birth was born, the main difference I noticed was the model of care. So instead of a physician-led model, it was a midwife-led model, which, as you know, prioritizes informed consent and also just family-centered care, like making sure both mom and baby are okay. And so at the end, I felt so empowered by the care that I was given that I thought more people deserve this kind of care and attention and treatment when they're pregnant, no matter what type of birth you have. And so that's when I started taking the research I had been gathering and I started just posting it online, more for myself than anything. I just wanted a place I could kind of compile everything I'd been learning, and it just took off from there.
Yeah. Thank you for sharing because knowing, that personal beginning and how many other people like you, right? We want to be treated well, so we feel like we comply. And it's amazing today, right? How many things are done that are not supported by evidence, or, also how can we help people, which you're doing so well, know that they can make different choices. So one of the things I heard in your stories is you shifted models of care. And I'm wondering, I know that you do a lot, and I love that you have kind of 5 red flags that you might want to switch to a different provider for birth. Can you take us through that and how that worked for you as well in switching kind of models and providers?
I think one of my problems, and I feel like a lot of parents have this, is that I personally really liked my OB. So we got along really well. And she listened to me. She took time to answer my questions. She sat down when she talked with me. She practiced at the time continuity of care, which meant she was going to be the practitioner at my birth, which is quite unusual these days for an obstetrician, but she was newer and didn't have as many clients yet. And so I think that's why I got to have her at my birth. And I think because of that is why I was able to have a vaginal birth, because she knew me, she understood my preferences, and she knew that I wanted a vaginal birth if it was possible, if it was safe. And so she was very patient in the pushing process. Now, I think we talk about red flags for providers. We also have to talk about red flags for facilities or where it is you're giving birth. And so in my case, the red flags I'm going to give you, my obstetrician would have passed all of these tests, but it's more that we often underestimate how much a provider can be limited by where they're practicing. So is that okay if I tell you the red
Yes.
flags first for the provider and then we move into the setting?
Facility.
Okay.
Perfect.
Yeah. So, anybody who's dismissive or doesn't listen to you or is kind of standing by the door, like with one hand on the door the whole time, big red flag, because either they're too busy for you or they just don't really truly care. And, or it might not be that they don't care, but like I said, they're just too busy and you're not on the priority list. So that's a big red flag, because if you can't have a conversation and they don't listen to you when you're pregnant, how do you know they're going to listen to you in labor? So looking for body language to me is important. Another one is if they tell you they won't support you. So if they say you need to lower your expectations, right?
Oh, that just like hits me in the heart, right?
I
On a
know. I'm a
day
big
that you're
believer
giving
in that.
birth.
Most of the time, not all the time. Most of the time, people will at some point give you a clue as to who they are. So if they don't plan on helping you fulfill your goals, there is some bait and switch out there where they're telling you what you want to hear, but usually at one point you'll hear something that makes you think, they don't really support me. Um, a third one would be using fear tactics instead of just having conversations about information, and conveying their authority. So this is what, we're going to do. Again, this comes back to body language, kind of standing over you, not sitting down, not seeing you like an equal. And then the fear tactics are actually a sign of, I believe it's a risk factor for disrespectful or mistreatment in childbirth, because anytime you're being pressured or coerced into something, you're not giving true informed consent. And that is a form in itself of obstetric violence. So, because oftentimes what they're pressuring you into might be a very invasive procedure. So, it's having something done to your body without your true consent because you were pressured into it with fear tactics. A fourth one would be mentioning a big baby, especially if they do it early in pregnancy before you can even possibly predict a big baby. I've had people tell me that they were told in the first trimester that they were going to have a big baby,
That's
And
crazy.
I know. Often for people who are larger bodied, they're told that early on, or they might be told you're going to have gestational diabetes when they haven't even tested you for it yet. So anything where there is discussion of a big baby early on, it goes to show that they're planting the seeds early to be able to control your birth. And it might not be because they're being manipulative or they have bad intentions, but they just have a lot of fears and anxiety around big babies and about the legal liability. So they're going to just, as much as they can, steer people towards an early induction or a cesarean. And then the fifth one is just, it really has to do with a lack of communication, like just feeling like you're not getting, you're either afraid to ask questions or there's no discourse. It's just they tell you what you're going to do and they expect you to do it, kind of treating you like a child. So those would be, for me, the red flags. But as I said, I had a really supportive provider, but even the best providers can be constrained by their facility. So for me, it's also important to know the statistics of where you're giving birth. What is the cesarean rate? And most people don't know that in the United States, at least, most hospitals post their low-risk cesarean rates on Leapfrog. So that is a good website. It is a little tricky to figure out, but you can compare hospitals and then look at their different statistics. And so there is a way to find statistics for your hospital, also their episiotomy rates. So knowing, you could have 3 hospitals within like a 2 or 3 mile radius. And one could have a 40% cesarean rate, one could have a 20% cesarean rate, the other might be like 30. And then in terms of episiotomies, which most people want to avoid the cut to the perineum with scissors, maybe one hospital is 15%, one is 10, and one is like 0. So knowing what the practice patterns on will help, because unlike me, most providers don't, unlike what I had, most providers don't practice continuity of care. So you're going to get who you're going to get there with you. And also there's different practice patterns and cultures and way of doing things that will increase the cesarean rate or increase the episiotomy rate. And if it's important for you to try and prevent a cesarean, if it's preventable, then knowing what's going on at your facility is really important. Yeah. And in my town, the best looking hospital, the most popular hospital with the newest unit, the fanciest furniture, the one that everybody wants to birth at, the one that has all the billboards, that one has the highest cesarean rate in our town. So it's not about what they look like on the outside.
Yeah. So many great tips. I really appreciate that because I find so many people, just like you said, they love whoever their caregiver is that they might go for their annual GYN and don't think to take the time to think through the great tips you provided to know if they're really at the right with the right provider and at the right location for their birth. But you also mentioned something else. And as a doula today, oh my goodness, we were just in a group and ranting on the induction rate. And you talked about that. And I'm wondering, I know you have so much good evidence there. If you could kind of take us through what to know before scheduling an elective labor induction.
Okay, so people always want to ask me about induction. It's one of the top topics. I have to pull out my pocket guide because
I
it's
love your
very.
pocket guide,
I
by the
know.
way. That's in my doula bag always.
The pocket guide to labor induction is really handy for me and for anybody else. Um, so I have questions to ask, and I'm looking at them right now. So, what's the medical reason for this induction? Um, what do the professional guidelines say about induction for this specific reason? So if they're an OBGYN, they should be able to tell you what do the guidelines state. And if they can't, you could ask, can I see a copy of the guidelines? Because if they're practicing in line with the guidelines, they will not be embarrassed to show them to you. But if they're not, if they're just practicing because this is what they like to do, then they might find a reason to not give you the guidelines. And then knowing more info about, making an informed decision if you want to have an induction is how ripe is my cervix? What is my Bishop score? So learning more about, is my body, would it be able to easily be induced, or would it be a very long, difficult process? Because if your cervix is not ready, then you're looking at a pretty long process to prepare the cervix, which could take 1 or 2 days. I also want to know this earlier. What is the induction rate in your practice? Out of the last 10 births that you did, how many of them were inductions? And that will let you know. I mean, maybe they have a lot of high-risk clients, but if it could just be that that's what they prefer, and so they try to talk everyone into an induction. And then what is your cesarean rate with inductions? Out of the last 10 inductions that you did, how many ended in cesareans? So even if they don't know their statistics, they should be able to count back and kind of estimate. Was it about half? Was it 2 out of 10? Because, we talk about the ARRIVE trial a lot, which many of your listeners may be familiar with, the randomized trial on elective inductions at 39 weeks. In that study, they found a slight decrease in cesareans with inductions. So induction does not necessarily mean you're at higher risk for cesarean, but it depends on the provider. If your provider has a very high C-section rate with inductions, then that's what you're going to get, right? It's all about the practice patterns of that particular provider. And then I also would want to know, what are the provider's preferred methods for cervical ripening? Is this a medication? If so, which medication? Tell me about the medications or devices, because most parents think they're just going to go in and hook me up to an IV, but that's not the case. They're most likely going to have to do cervical ripening. And that can be, that's a process that deserves its own conversation. So I hope those questions were helpful.
Really helpful. And I think for everyone listening, so important, at least in my region, I'm in New Jersey, we're seeing a very high induction rate right now. So great guide for people. And your pocket guide is, I think, really essential for everyone as well. We'll put the links in the show notes to those as well. So another question that I get a lot, and we're seeing a lot of change right now in providers and in what people want, is alternate birth positions. And I know that you also talk about them. Could you talk a little bit about different birthing positions and their benefits?
Yes. So I have my handout ready because everybody asks me this question. So if you go to ebbirth.com/birthing positions, you'll find everything that I'm going to talk about. The handout is free and all the references. So birthing positions, I think we need to differentiate pushing. We have labor positions, pushing positions, and birthing positions. So most people are pretty free to get in whatever position they want in labor. Now, if you have an epidural, you might need some assistance getting into different positions in bed. With the peanut ball is a great tool. But then when you get to pushing, pushing the baby out, I believe most providers are supportive of various pushing positions. But what I see the most power struggles over is something called birthing positions. That's the position you are in when your baby is actually emerging outside. So, um, so upright positions are helpful in labor, with pushing, and with birthing. But unfortunately, many obstetric providers, mostly OBs in the US, but some midwives in other parts of the world as well, want you to be on your back when you actually deliver. And I don't like the term delivery, but I'll use that because that kind of describes the moment of the birth. And upright birthing positions, though, we have so much research showing that it provides more oxygen to the baby because you're not compressing your aorta, the large blood vessel, and it lowers pain, so it reduces suffering. It can lead to lower rates of emergency cesareans and better birth experiences and memories. However, even despite these benefits, we still see people coerced into back-lying positions, either semi-sitting or on your back. But what you're doing is you're typically semi-reclined or you're sitting on your tailbone. And those positions also don't allow the pelvis to flex to its, a little bit more to allow the baby to come through. And because most people are coerced in or told to push and give birth on their backs, it's actually quite rare to see upright births in the United States unless you're at a home birth or birthing center. So I think the last data we have on that was from about 10 years ago, and 3% used side lying, 4% used squatting, and 1% used hands and knees. But other than that, everybody else was either semi-sitting, kind of reclined, or on their backs in the lithotomy position. And some more benefits about being upright include you're less likely to need a forceps or vacuum to get your baby out. The pushing phase is actually shorter. You're less likely to have severe tears, and there's no increase in the risk of postpartum hemorrhage if you birth upright, which is kind of a misperception. So you can use my experience as an example. I don't typically like anecdotes. They're not necessarily the best evidence, but I think stories can help illustrate what happened. So with my first birth, maybe my baby ended up only being 6 pounds, 8 ounces. We didn't know that at the time, but she was posterior. So her back was against my spine, or like the back of her head was against the back of my spine. And so she was not in an ideal position. And because I laid on my back for 24 hours and I only ever pushed laying on my back, I did not use gravity or movement to help like shimmy her down. And because of that, I had a very long, very difficult second phase of labor and pushing phase and needed the vacuum. And you contrast that with my second baby. I was a big fan of spinning babies, so I was using that. I knew which position my baby was in when I went into labor, and then I used water immersion and movement, all of these things to make sure I wasn't laying on my back the whole time. That baby ended up weighing 10 pounds, 2 ounces, and it only took me like 15 to 20 minutes to push him out with no difficulty, no vacuum. And then my third baby was the exact same weight, 10 pounds, 2 ounces, and I pushed her out in just a couple of minutes. So it just goes to show you, like, size of the baby can matter, but so does so much more, right? The position that you're in, the movement, gravity, the baby's position. So, I mean, the bottom line is, evidence supports upright birthing positions and side-lying birthing positions. And it shows that in the most cases, risks go up if you're lying on your back or sitting on your back. But also you have the human right to birth in whatever position you want. It is regardless of what the evidence says. If you felt more comfortable lying on your back, then that should be your choice, right? But it's not typically what's happened unless you're in the midwifery-led model of care or with a physician who trained with midwives. Most physicians don't see upright births, so to them it's upside down. And I'll never forget, I was at a birth where she was pushing on hands and knees in the bed. And as the baby was coming out, the doctors were trying to understand, they look at the landmarks of the baby's head. the fontanelles, and that's how they can tell what position the baby is in and if they're making the cardinal movements. But because this mom was leaning forward, on her hands and knees, to them it was backwards, upside down. And they literally could not visualize what was happening. And so doctors get afraid of that because they think if there's an emergency, I won't know what to do because everything's flipped. So it's just all about their training, really, in the long run.
Yes.
Yeah.
Thank you for sharing that because it's so disheartening, as you said, that they don't have the training and that's trickling down, that we're not seeing as much real freedom of choice for that, even though it
Right.
is everyone's human right to choose their birth position. So thank you for putting all that evidence and sharing your stories because those are some big babies.
They were. And I think it's a good example of the power of knowledge and information and knowing, but then also trust in your body, and then having a provider who trusts in you and is comfortable with that. And I am meeting more and more OBs who are, they're fed up with the way it's been done and they want to see change. But other people in the room can also be nervous when you see, like I said, they think it's upside down, whereas we think it's upright. So it's just a culture change, and it'll take time to change, but I do see positive change happening.
Yes, I agree. We're working toward that. So, as we're coming to the end, I'd love for you to give, for everyone that's listening, what would be a tip or two that you would say? You've given a lot already, but just in general, preparing for birth, there's so much fear, sometimes anxiety out there. Do you have any last words of wisdom for people preparing for birth and those that are supporting them?
Yeah, that's a good question because I think, I know at Orgasmic Birth, you work on this a lot with mindset, and it's so important. I had, when I worked on my PhD, I actually specialized and got training in cognitive behavioral therapy, and I don't talk about that a lot, but basically it's the power of your thoughts and your behaviors and how they influence your physical symptoms, your emotions. And so knowing, like, almost coming up with a way to cope with anxiety during pregnancy and birth is important. So for some people, knowledge can be reassuring. Taking a really good childbirth class, having a doula you can text when you have questions, having a therapist, having people you can talk with. For me, I did a hypnobabies based training because I felt that for me it's basically like a really deep meditation, training my body and my mind to release and let go, and then making sure my partner was also educated so that I could count on them to speak up for me if I couldn't speak up for myself. So anything you can do to prepare yourself. Often see the opposite, where I feel like people who follow evidence-based birth tend to want more information. So they're soaking it all in, almost getting too much in their head, a little bit. But then you also can have the opposite, where people they're so afraid of it that they recoil and they try to avoid information. And I think trying to encourage people, if you have that, to, you want to learn, but you also want to guard your mental health. And if you're learning about something that's really disturbing, maybe avoid that information. I don't want to say put your head in the sand, but you don't need to be listening to traumatic birth stories. So when I have friends or family who are pregnant, it's all about, how can I help you find the right provider? So I do a lot of connecting them with providers in their hometown, and a doula can do that with you as well. Finding a doula, making sure they have all the education, making sure whoever is going to accompany them at the birth has all the education they need, and that can make all the difference. If you're prepared, your birth partner is prepared, you trust your provider and where you're giving birth, makes a big difference. Of course, not everybody has that, in which case then you just need more advocacy skills, which you can learn. So
Thank you so much. You've given us so many tips and wisdom. I think for many people listening, hopefully you might go back and listen again with something to take notes on. So many good questions. And I know, Rebecca, people would love to know how they can follow you. Can you talk a bit about where you are and what classes you offer that people can connect with?
Sure. So just go to evidencebased.birth.com or Google us, and you can click on the blog articles or the signature articles at the top and search our website to see if we've published something you're curious about. And then you're welcome to follow us on our podcast on YouTube or Spotify or iTunes, and just go from there. Just, learn what you can. I know it can be a little overwhelming, so just dip your toe in, start listening. If you're pregnant, I recommend listening to Empowering Birth Stories on any podcast. And if you're interested, we do have childbirth classes at ebbirth.com/childbirth class. So we have instructors around the world who can teach in person and online.
Thank you so much. It was such a pleasure and honor to connect with you after sharing about your work so many times in so many places. So thank you so much for joining us today.
Thank you so much, Debra, and thank you for everything you do to help empower families as well.
And thank you to our listeners. We always love to hear from you. Please share your comments, your thoughts, tag us. We'd love to hear what's your takeaway, what's your favorite tip that you're putting into your preparation for birth or as a doula supporting your clients. And we hope to see you next week on the next episode of the Orgasmic Birth Podcast.